So yeah, this week is a good week. We have in combination some good topics of discussion, because now we finally get into, you know, we get into like nursing aspects of things. So this is like our fun stuff, like our comfortable stuff that we can do. So yeah, how did you guys feel about these topics? Anything alarming to you guys? Things you didn't know, things you really liked, that kind of thing? Things you wanted to go over this week? Things you didn't even look at? What, we can run down the list. Let's see. We have like animal nursing itself. Just like basic stuff. So, you know, like what would be, zoonotic types of things. What would be certain type of respiratory diseases, which like is consistent with dehydration things, like packed red blood cell type of things, like their mucous membrane, skin turgor aspects of stuff. We had a question about a sarcoma that arises from blood vessels. What is that? Anyone? You're completely behind. It's the end of the school year and my teacher's assistant quit. You're a teacher. Awesome. Trying to keep a, yeah. My husband's a teacher too. He's in like autopilot right now. So.
Hey, Beth, can you repeat the question?
Absolutely. A sarcoma that arises from blood vessels. So I can give you options. So we have lymphosarcoma, hemangiosarcoma, osteosarcoma, and liposarcoma.
Would it be the hemangiosarcoma?
Yeah, absolutely. Absolutely. The liposarcoma is a made-up word. Don't worry. Yeah. Yeah, that's really good. Absolutely. Yeah, and then another one. So like inanimate objects such as water bowls, cages, clipper blades, and scrubs, where pathogens can survive and transmitted. What would that be called? I love this word.
Fomite.
Yeah, fomites. I just love that word. And so like you just run around the practice saying, that's a fomite, that's a fomite, that's a fomite. Like we always would do that. So yeah, we try to make sure that we reduce the amount of fomites within a practice, especially our surgical areas, right? So that, number one, we don't have to clean it all the time. Make your life so much easier when you're cleaning your surgical suites, and just keep it to a minimum, right, of what you actually have in there, or like put things in containers so you just have to clean the outside of the container versus every little area and whatnot. But yes, all of the things that are in your, even like thinking your house, right? Like when you have to dust, like everything has to be dusted, right? Like just think of it that way, that you just make it so much easier. If it's like in a cabinet, you just have to clean the outside of the cabinet, versus like if it's no cabinet door, you actually have to clean everything that's in it. So all of those then become fomites. So same thing if you had a piece of paper that was taped onto a cabinet, the actual piece of paper is a fomite, versus if you know, it's harder to clean, versus if you laminated it, it's still a fomite, but you can actually clean it better that way. So, all right. So during a fundoscopic exam, I have a hard time saying it, findings of enlarged retinal vessels and retinal hemorrhage are early warning signs of impeding retinal detachment due to what type of potential condition, I guess. Would it be like diabetes, congestive heart failure, upper airway disease, hypertension?
It's diabetes, right?
No.
No.
Hypertension.
Hypertension, very good. Hypertension. Now we could get a little bit deeper in that, right? Deeper in that conversation, and think of the hypertension could also be coming from the fact that many times those animals could be even like renal patients, stuff like that, right? We see that a lot in our renal kitties as well. So usually that hypertension is stemming from something else going on too, right? So we always look at additional things. But yes, hypertension, right? So yeah, be careful. You have high blood pressure, right? Your retinas are gonna bust out. So you don't want that. Awesome. So these are some of the questions if you haven't gone into it. So definitely read up. And these are all like VTNE like questions. So when you read these questions, many times, here, I'll actually share my screen so you guys can see. Maybe I'll share my screen if I actually click the right thing. Many times, if you read these questions and you start looking at the actual answers first, right? So don't even, so like, let's read this one here. If you actually read this and say, okay, forget the actual question itself, like what's like up with this question, like auscultation, echocardiography, electrocardiography, and radiography, like what are these things? Doesn't really fit within here. Like, all right, maybe these kind of go together, I guess. Auscultation, we're just listening, you know, like, all right, they're going to be asking something, I guess, within whatever. Maybe these are related to the heart. This is not per se. So we have kind of an understanding of what they're going to be asking maybe. So now we can look at our questions. So the diagnosis of dilated cardiomyopathy, which of the most is the most common cardiomyopathy in dogs, is confirmed by all of the following except what? Well, how can we diagnose it, right? So I guess we can diagnose it from radiographs because we actually have to see it, right? We can't just like diagnose it off of like not seeing it. So now we understand. We can't diagnose it off of auscultation. So it makes you stop for a second because many times you guys get through this and you're like, read, hurry, click, and you click on the wrong thing. So even if you just read these guys first, and it makes you stop and think about it, or you're reading, oh, these are so close together, right? So you pick the wrong one. So it makes you stop a little bit and go, okay, what's so different about all this stuff? So think on that level too, that, oh, I'm getting nervous. Maybe I should change it up a little bit. So here too, Pneumo Effusion. That seems a little weird. Pneumo Effusion, Pleural Effusion, Pulmonary Edema, and pneumothorax. Like, have you ever heard of Pneumo Effusion? Maybe not. I don't know. So here, the accumulation of excess fluid within the thoracic cavity. So it has to be fluid, right? Pneumo's air. So that's probably not it, right? And then we have pneumothorax, again, air. So 50-50, you're playing Who Wants to Be a Millionaire? So then we have pulmonary edema and pleural effusion. Those are our last two. So what's the answer here?
I'd say pleural effusion.
Good, pleural effusion. So why is it pleural effusion versus pulmonary edema?
Isn't pulmonary more in relation to the heart?
So what's pulmonary?
It's more within the lungs.
Okay, so it's lungs. So then what's edema though? Can you suck off edema?
Isn't edema more like swelling?
Yes, good. So yeah, can you actually, will you be able, so is it fluid, right? Like Jessica wrote, fluid in the lungs. It's not necessarily fluid in the lungs. It's swelling, right, in the lungs. So it may be like how we say we might have increased our fluid too much, like a fluid overload, but it's the swelling though. So we still might we won't be able to tap the chest, right, to get the fluid off. We'll have to give a diuretic to get that swelling off. But we won't actually be able to tap the chest to get like the fluid off. So it's a lot different. So just like, you might have edema from, in your leg or something like that, or swelling in your hand after you hit it on something or whatever. That's just edema, it's swelling. So same thing in your lungs. Effusion, so effusion means you actually have fluid in your lung space or near your lungs, where we actually can stick a needle in that space and we can pull off fluid, no problem, right? So, and then be able to sample it or whatnot. So effusion always means fluid that we can take off. Edema means that it's swelling and that we're gonna have to give a diuretic to have them excrete it out. So, great. All right, so then excess glucose that's stored in the liver and muscle tissue as blank can be quickly metabolized when needed or converted to fat for long-term storage. So we have glycogen, glucagon, simple sugars, and globulin. Good. So most everyone's saying glucagon. Yeah, you guys are right. So, so you guys are actually what we actually need, sorry. So, so you guys actually, what it is it is actually glycogen. Glucagon is actually something that is a hormone that is secreted to break down glycogen and our sugar itself as well. So all of that is stored actually in our liver. So good job with the glycogen. All right. So in this one, so let's say this one, we're looking at these guys here. So these guys are all fairly probably related in some way, right? When we look at it. So we have pulmonary thromboembolism, congestive heart failure, dilated cardiomyopathy, and feline arterial thromboembolism. She's like, we got it, D, right? Hey, you cheated. You looked at the answer. I say the answer, the question, right? So clinical signs of blank include high limb paresis, paralysis, and severe pain, cyanotic toe pads absent, and poor femoral pulses, and coolness of the affected limbs. So if you just read this really, really fast and then just went to pick an answer, right? Who would have picked just A right away? Because you would have saw thromboembolism and then chose A, and you would have never known the difference. I probably would have, actually, because I'm just a terrible test taker, and I would have just moved on. And I would have never known the difference, honestly. I would have just picked A and moved on because I would get so anxious in tests, and then I would have just picked. So that's why a lot of times if you just slow down, read the answers first, and then go back, then you at least read these guys and know what you're looking at first. Oh yeah, right. After hearing it, oh yeah, totally. I feel so bad for them. So, and you can understand here, like, you know, the whole process of them, like the feline arterial thromboembolism, why they're going through that, right? They have some, right, a heart issue per se. It's not necessarily dilated cardiomyopathy as we know with cats per se, right? What is really most likely with cats that's wrong with them on their end? Hypertrophic. So that one's out, right? So we know that. Like, let's play a little stupid here. So we know congestive heart failure is not it, and then we know that it's not pulmonary embolism because pulmonary is not it. So we're good. So yes, you're right. D is the answer. So good. And then what here? So if we look at this, ascites, hypoxia, pulmonary edema, and dyspnea, right? Oh, it's not like letting me do it. So these are all a little bit different. So we have 3 of them that are kind of lung-like, and then we have ascites. So that's a little interesting. So what would be likely clinical finding of an animal undergoing right-sided heart failure? Ooh. That's interesting. One is different than the other 3. I wonder why. Right-sided heart failure. What would be the answer here?
A.
A, absolutely. So in this case, it was so good to actually look at the answers first, especially if you didn't know. that it's A, to be like, oh, well, these other three kind of fit. And then this one, why did they put ascites there? Right? That's like weird. So yeah, A is the answer. This is like a bad situation. It definitely does. Of course, it makes sense to you, Jessica. But if for some people, when you're really nervous, sometimes, remember, you blank, you forget. Just wait. I have a game for you guys today that you're gonna love, and it has really obnoxious music to it. And you're like, I know you blank, right? But it has really obnoxious music to it to make you nervous and stuff, so you'll forget. Great. So treatment of, I know, I just try to throw you guys all off to see how I can make you nervous and put you in a state of panic. And it's a game setting, so all of you that are competitive, that'll throw you overboard. So okay, treatment of canine heartworm disease consists of adulticide therapy, microfluorocide therapy starting at 3 to 4 weeks later. Adult heartworms die slowly over a period of 2 to 30 days. During this time, patients are at risk of what? Wow, Casey, she's on it. Why is that? Now we're going to play the why game. I'm like the little kid. Why?
Don't the heartworms like die or get caught in the pulmonary artery?
Okay. Just like little bits and pieces of them, right? They just explode. And yeah, they break, and then yes, they're going to get caught, and they potentially are going to create a thromboembolism. So yes, 100%. Good. Oh, good. I love this one. I like this one. I came from a little bit of oncology, so I like this one. Okay. Blank can cause mast cell tumor activation and histamine release that may result in severe hypotension. Therefore, use of this drug is contraindicated in mast cell tumor patients. Sarah, good job. All right. Why is that? What about morphine? Why morphine? What's so special about morphine? Since you all are so fast about answering about morphine. What does morphine do? Hence the morphine and itch. Yes, it releases. It has a huge histamine release. Absolutely, 100%. Especially if it's given IV. Don't give it IV. Oh my gosh, it's horrible. So yeah, you're absolutely right. And that morphine itch is awful. I wanted to itch my whole entire face off when they gave it to me after I had one of my C-sections. I was like, this is just no more ever again. So yeah, absolutely perfect. Great. All right. So in here, radiography of the blank is most commonly used initially to evaluate the presence or absence of metastasis. Great. Okay, so why would you choose C here? What do we look at for okay, good. Heart and lungs. So yeah, so when we look for metastasis, typically We're looking really at the lungs for metastasis first. So yes, very good. Very, very good. All right, are you gonna get this last one in here, right? So heartworm disease is a mosquito-borne infectious disease that affects both cats and dogs. Clinical signs of heartworm disease differs between cats and dogs. This difference in clinical signs is a reflection of worm burden in the longevity of adult worms, which statement is true. In dogs, adult worms reside primarily in the pulmonary veins. In cats, adult worms reside blah, blah, blah. It lives longer in dogs than cats.
D.
B. In cats, adult worms reside in the left atrium. You guys say C. Adult worms, so you agree length of time. Ooh. Carry a heavier burden then. So, and you say C. So they're not going to live in the left atrium. Look, it died. Here, let's see really quick. Because now I'm like, this isn't. Yeah. I was going to say it has to be that they reside in for a longer length of time, because in cats, more or less, you're going to see less female heartworms. So longevity wise, I guess longer. There's just not going to be as many of them, or like multiplying. So no, we did not do the nutrition one. We are going to take a peek at that one next, because I know most people definitely like to look at that one for sure. So we're going to do that one next. That's kind of a sucky question, honestly. It should be a little bit more straightforward. Okay, I'm gonna actually take a look at that one. All right, let me get to our nutrition one. We'll go over that one a little bit, and then we're gonna have some fun in a game because I like it. Nutrition. Did you guys do a lot of nutrition in school? Angela, you're on mute. Kristen says no. A whole semester, awesome. No.
We had in Penn Foster, we had a class on animal nutrition.
Awesome, that's great. I love that. A whole semester, good. Well, I love when there are places that have it because it's super important. I mean, we have to do a lot of changes in our way that we take care of our pets, and we advise owners and stuff. So I mean, we're the ones that need to educate owners on nutrition, so we can't shy away from things. So that's really good that you guys have had nutrition as well. So that's awesome. All right, I'm starting my attempt even though I'm not really doing it. Great. So great. So when we look at this, right? So this one says, what nutrient will provide the most calories per gram? Okay. So again, we're measuring essentially in 1 gram, how much has in one calorie, if you had 1 gram of each thing. So if you had 1 gram of carbohydrates, does that give you a lot of calories in that gram? How about vitamins? How about protein? And then how about fat? Which one gives you the most calories? Yeah, it's the bacon, man, the fat, right? The fat in the bacon. So absolutely. It's the good stuff. So yes, fat. And then patients with pancreatitis or hyperlipemia should avoid foods in high what? Fat. Look at you. Fat, fat, fat. Yeah, fats, right? So these guys in general, like pancreatitis patients, essentially their pancreas is super, super angry and super sensitive to fats at that given moment. So we have to be really careful at that point to introduce too much fat at a given time. So when we are talking to owners, we don't necessarily have to just go straight to, okay, we need to prescribe you a prescription diet that has this, you know, whatever prescription. We just have to look at a bag that has a lower content of fat, you know? So if an owner can't afford a prescription diet, give them something that's a blander diet with a lower fat content. You know, we have to be able to compromise in some cases for owners if they can't afford that. So, I mean, especially now, there are certain prescription foods that are on back order, you know, so finding something that's going to work for that pet as well, just so that they can take care of them. So, all right. So the principal display panel is required to contain all of the following. So on their label, they have to have all of the following except the brand name, the nutritional claim, the net weight, and the manufacturer claim.
B, nutrition claim.
Thank you. So yeah, B, nutritional claim, right? So they do have the manufacturer name, so where it comes from, they have that. The net weight, of course, we always see that they have the net weight at the bottom. So whether or not like you are buying a 24-pound bag or a 12-pound bag or 8-ounce can or whatever. And then the brand name, so whatever you're buying, like Purina or Hills or whatever. But nutritional claim, they don't have to necessarily say what it is, what's it all about. They don't have to. And so that's kind of up to them on what they want to put on it as well. There's a lot they don't have to put, or it's kind of up in the air. So what nutrient makes up the greatest part of most dog rations and supplies energy? It's crazy. I thought I would throw you guys off on this one. Especially when we see commercials that say your dog is like a wolf, right? So yeah, it's D, right? So it's carbohydrates. So when you guys look at a guaranteed analysis, it'll give you the protein content. So it'll say the percentage, it'll say the percent of fats, it'll say the percent of vitamins vitamins, and then minerals are in ash. But it actually doesn't give you the percent of carbohydrates. Let's see. I thought about how human foods are made. A good number of them are carbs. Yes. But in dogs, or I should say dogs and cats, they don't actually write how much carbs are in there. So But in dogs and cats as well, they're actually mostly made up in carbohydrates. So if we think about it, we have to look at it. What type of carbohydrates are they made up of? So we have to first take that percentage. So the percentage can be somewhere around, oh gosh, I think if we talk Beneful, I think Beneful was at 1.46% carbohydrates. And then people became aware of how much that was. And so Beneful was like, oh my gosh, we have to change it because people are not happy about that. It's 46%. That's a lot. So they reformulated it and they reintroduced it and said, new formula, less carbohydrates, whatever. And it was 43%. So that's their new formula. But then we have to look at what type of carbohydrates are there. You can do carbohydrates that are like all corn. You could do carbohydrates that are all potatoes. And then you can mix it with some grain as well. You can mix it with some really good fruits and vegetables as well. So like, mixing certain things are going to be really good. Some have like antioxidants in there. So we have to play with our food a little bit more to make it beneficial. It's just like with us, right? If you sit there all day eating steak and potatoes, it's probably going to end up weighing on you a little bit differently than if you're eating carbs that are vegetables and fruit and a little bit more balanced, right? So this is why we need to look at the ingredient list for our pet owners and say, yeah, this is probably a little bit better for your animal based on their activity level and all of that jazz. So yeah, we have some work to do. Now, thinking about how animals are in the wild, right? So wolves and stuff like that, right? They don't necessarily eat carbohydrates out in the wild, but they do eat animals that are eating grain and stuff like that. So yes, they eat meat, but then they also are obligate carnivores. So they eat those animals that eat the grain, and it's like the woman that swallowed the fly kind of thing. So yeah. So which of the following is not an energy supplying nutrient? Oh my gosh, good. Great, but it's the most important nutrient of all, correct? Yes, you will die without this nutrient. Without water, you will die. Awesome. Yes, ma'am, you need it. Great. So yes, our energy supplying nutrients are water. I lie. Our energy supply, look, I'm on water right here. Our energy supplying nutrients are protein, carbohydrates, and fat. And our non-energy supplying nutrients are water, vitamins, and minerals. Okay, so large or giant breed puppies should be fed large breed puppy food until they reach the age of good. Kristen's on it. There you go. Yeah, 2 years, right? Why is that? Why 2 years? Why not 6 months? Or why not a year? What's so special about large breed puppy food? Yeah, growth span, perfect. They take longer to develop. Awesome. But what's in puppy food? Ever look at a bag of food on the back? Nutrients for joints. Okay. Like what? Calcium. Good. Sure. Higher fat protein ratio, a little bit, but nah, not horribly. What else? You're on the right path for the calcium for the bones, but there's other things. Sure. What else? There's some other things for bone growth. Vitamin D. Good. What else? Who has a baby at home or has had a baby at home? What do babies need? Yeah, they all have amino acids. Colostrum, but no, what's in your, if you do formula, what's in like formula? DHA, yeah. So you'll see that in puppy food. They need it for bones, man. Bones and brain. Otherwise, if you don't have DHA, your puppy is gonna be not very smart. They need it for bones and brain. And so calcium, and there's another one too for bones. Starts with a P. P and an H. Phosphorus. Yeah, phosphorus. Awesome. Yes. So yeah, those are our big ones that we like to make sure that they have for growing, right? And especially our big dogs. So yeah. Yes, they could have additional calories in there and stuff too, and additional fat content and amino acids to make sure that they have nice, healthy joints and stuff. But we really want them to grow their bones and their brain healthy as well. So food allergies are usually due to which part of the diet? See, I should have put grain in here, but that would have screwed with you guys too much, right? Yeah, it's protein, right? So typically, we kind of try to eliminate proteins first and try a new protein. If they are showing like an allergy to a protein, and then we would typically go, all right, try something that doesn't have feathers, right? So no chicken, no turkey, no duck, if that's the case. And then if that is still not working, then there are limited ingredient diets out there that truly are just, a protein, a couple carbohydrate types of things in there, and a few like fat sources, and the ingredient list is super, super tiny. So they do have those out there for the ones that have really bad allergies. Oh yeah, food allergies are terrible, really terrible. So I feel bad for those who have to go through it. So sorry, Casey. And you have two, like, ugh. So what condition does not cause obesity in companion animals? So overfeeding, that probably causes some obesity. Insufficient exercise, genetic predisposition, and surgical neutering in males and females. Yeah, so this was an interesting one, right? So So it was a kind of like a thing before where people said that if you neuter your male or female dog, that your animal would become overweight. It marked you wrong? That's weird. I'll have to look at that then, because that shouldn't have marked you wrong. Maybe I just accidentally put the wrong thing in there, but no, it should be D. So, so here's the thing. It can, right? Your animal can gain weight, but the reason for that is that their metabolism changes due to the fact that we have now messed with their hormones, right? We have spayed and neutered them. And so when it messes with your hormones, your metabolism changes, and we don't change their feeding. So that's on us to then educate owners to say, okay, well, their metabolism has changed, so we need to change their feeding regimen because now we're overfeeding them. Does that make sense? So you're right in the sense that, yeah, they're gonna gain weight if we continue to feed them the same amount that before they had a higher metabolism, because they're, they were not spayed and or neutered and whatnot. But now we have changed their whole entire hormonal system. The same goes for us as humans. If we had a hysterectomy and all of that too, our whole entire body system would change. And so we would have to, adjust to everything as well when our hormones and our metabolism changes. So, Sarah, I'll have to look at, I can change that. So I'll look at it and fix it if it is like that on the surgical one you said. All right. All right, I'll look at that. So yeah, that's just the misguided part of it for people who believe that. So so fiber serves as a major energy source for the following. Also another one that confused me, the AFCO rules. Yeah, AFCO. We'll get to that. All right. So fiber serves as a major energy source for all right, so we have snakes, herbivores, essentially, carnivores, or monogastric animals. All right, so here's a good one where we can kind of look at these answers and go, which one doesn't fit in here, right? So snakes, what do snakes eat? Rats, mice, that kind of thing, right? So they eat like meat, like they don't eat fiber. They don't care about fiber. They would die before they would eat fiber. So yeah, so that is out. They don't want that. Herbivores, they absolutely 100% are going to eat fiber. So yes, carnivores, same thing. They eat meat. And then monogastrics are the same thing as snakes, carnivores. We are monogastrics, right? One stomach, yes. So yeah, the answer is herbivores. This was meant to trick you guys. This is like a Beth question. So it's a hard VTNE question. So, all right. Lack of what nutrient is associated with prolonged clotting times? Yeah. Vitamin K. It just reminds me of like a good cereal. Like, eat your vitamin K so you will clot today. Awesome. The pet food that is labeled flavor with an ingredient has to contain at least blank of that ingredient per AFCO rules. All right, so AFCO has some interesting rules that they put together. So in their rules, it can, and this can go for essentially like anything that you guys, even in human consumption stuff, like if it's free range or organic and whatnot, like it just depends on the definitions that are set forth that they create. So like organic only necessarily means a small percentage of it being actually organic, or like free range means that they actually only have to be out like 3% of the time to be actually considered free range. So it's a very minuscule amount of time. Oh, okay, 5%. Sorry, my bad. Very small, very, very small amount of time. So, so for flavor, when we look at like pet food labels, what does flavor mean on a pet food label? Like you have filet mignon flavor. Is it just 5%, 10%, 0%? Artificial flavor to help the animal taste it. Exactly. Right. It's just a trace of it, right? Just to make it a dab of it so that they like, oh yeah, that tastes like filet mignon. So truly it's 0%. They don't really have to have it in there. Yeah. It's like a gravy. Right. So it can be deceiving. It's like kind of deceiving. I think that is, but whatever. Awesome. So we kind of answered this one already. So, perfect. Okay. So the most important ingested nutrient, so we kind of answered that, is water, right? We need our water. Anemia is caused by a deficiency of what? Protein. Yes. Yes, yes, yes. We need our protein so we don't become anemic. And this would be for like, I should clarify, especially for our omnivores, carnivores, that kind of thing is really important to know. So if they're not getting their appropriate protein sources, then they can be extremely anemic. So you may have seen some vegetarian diets out there and that kind of stuff. So it's really important that they get an appropriate and digestible protein, or even in general, so that they don't become anemic just from food. So this went through matching the following choices. So adult maintenance. Oh gosh. So adult maintenance is showing us their, oh gosh, adult maintenance is showing us their actual informational panel, principal panel. Yeah, principal display panel there. Purina Puppy Chow is their actual No. Guaranteed, no, 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 no. No. Okay, hold on, let me do this. Process of elimination. Best before June 20 this. So this is freshness date. Here is our net weight. Here's our ingredient list. This is our guaranteed analysis. Am I missing something? Nutritional adequacy statement. Oh, this is it. That, and then that. There we go. Thank you. Look at Sarah. She's on that too. I'm like, wait, I'm mixed up here. So that's those guys. That's helpful. So when you guys you hate the drop down menus. What? This is so much better than when we had it on Google Classroom though. Oh God, that was a nightmare. Google Classroom's not pretty. So when you guys go and look at a bag of food, because I know that's exactly what you're going to do this weekend. You're going to just be like, oh yeah, let me go look at a bag of dog food and see what this all looks like, right? You'll see like a guaranteed analysis, and you've probably seen it before, but the guaranteed analysis will have all of that stuff in there. So you'll be able to see it. And then like your ingredient statement list, we'll have it listed, right, with the most important ingredient first. So the one that has the highest content in it first to the least amount for, at the end, right? So your one that's listed first, if it says chicken in it, that means exactly what it says. So chicken meaning what? What kind of chicken? Is it an assumption? Do you think that that's chicken meat? Chicken flavor. No, right. So it's really good to get in a habit of looking for some type of food that says deboned chicken, right? As a first option for meat source. Now, people assume that like not necessarily chicken, like you don't have to get chicken, but like as a meat source, you have something deboned, whatever is your first meat source. Now, there are individuals that are like, oh my gosh, you can't have a meat source that has byproduct, right? Now, as long as you have a meat source that has meat in it, like a deboned something, later on in your ingredient list and there's byproduct in there, that's totally fine. I mean, think about when animals eat things out in the wild, they're going to eat every part of the animal, right? So if they are eating that in the wild, then yeah, your animal can absolutely eat the byproduct. Now, what is byproduct? Good question, Sarah. Anyone know? Anyone know what a byproduct is? Some of you may eat byproduct as well, if you're adventurous. Basically parts we don't eat. In certain hot dogs, maybe, yeah. The leftovers, yeah. Some people, that's not leftovers. It's exactly the same. Yeah, so organ meat, right? Organs, yes. Absolutely. It's organs. Yeah. So, which, I mean, it has great nutrients for them as well. So, but what's important to know is that that can't be the primary source. They still need to have meat as their primary source. So, make sure that, you know, you guys are kind of looking for that. And then byproducts can be like definitely a number 2. Now, what about if you got something that said chicken meal? What's meal? Now you guys have to go and look at your food and see what is in your food. You're going to be like so surprised. You're also going to be really surprised if you look at all of your prescription diets at your work. So what's in your protein meals? Okay, that's pretty dried chicken. What about the chicken though? What is that? So essentially what happens is, right, we take off the deboned chicken. It's not real. We take off the deboned chicken first, and that's used first. Then we take out the byproduct, right? And that's used. And then we have whatever's left over, correct? And then the rest is considered for the meal. Yeah? So then what they do for the meal is, yeah, there's bone marrow, there's all of that. And so then they take that and they like grind it all up. And then they make that into literally a meal, like a tiny thing, tiny meal of sort, right? They just mix it all together. And that is what that product is, and they make that as a protein source. So there are, yeah, the leftovers, literally the scraps of food that's left over. So it's like Tiny Tim's meal, Tiny Tim's source, right? So there are foods out there that are literally their first protein source is chicken meal, right? So yeah, you're understanding that correctly. Yes. So when you guys think of it, think of, all right, so the products that are out there, there are first, the first dibs are the deboned chicken. Then they have the second dibs are the byproducts, right? And then the last are the chicken meal. And that's how they kind of line it up. I mean, they make like byproduct meal too and stuff like that out of it, but I mean, they essentially just take the byproduct out and make it into a meal itself, but it's the same thing. So, but yeah, think kind of on those lines. No, it's good. You know now, you know what that is. So, and what the thing is that that knowledge now you have to take that and go, okay, I know that what I need to do is look at that food, and even though I might be paying this, I need to evaluate, all right, what can I afford to get? Is there something that might be a little bit better? And for longevity purposes for my pet, it might keep my pet out of the doctor's office for a longer period of time. What can I afford that might be a little bit better? You can look now at the back of food and find something that is good. And who knows, the food that you might be feeding your animals perfectly fine, but it's good to know so that you can look at this stuff and evaluate it as well versus like never knowing. So yeah, I think it's really important. And the funny thing is it really fits into our own nutrition too. Like, I mean, I guess we're not sitting there eating byproduct unless you really are, or like the bone marrow of stuff unless you're really wanting to. So you can make like bone stew or something. So yeah. So we already talked about this one. So pet food label list ingredients from how? In descending order by weight? Yes, good, good. Okay, so this guy, since you all love math so much, spam, yeah, just do spam. So Lucky is a 2 kilogram, 4-month-old male domestic short hair feline. Would require approximately how much daily energy supplied by his diet in kilocalories per day after just having surgery? Look, Casey's like on this. All right, so first we have to figure out how much RER is needed for this little kitten. And so what is the RER for this cat? Good, it's 130. So how we do that obviously is 2 kilograms times 30 plus 70. Now to figure out the MER, so maintenance energy requirement, we take that 130 and we're gonna multiply that by the energy that's needed for this cat. So normally if this cat for surgery needs a higher amount, right? So for surgery purposes, we typically do somewhere like 1 times 5, or I'm sorry, 1.5. But look at this cat's age. It's a trick question. This cat is a kitten. It's only 4 months old. Must be a shelter cat because I don't know that I would have probably done a 4-month-old cat. So for a kitten, what would our multiplication be for this guy? So like high energy is 2, and then kittens are 3. So we take 130 times 3, and it's 390. Yeah, so it's D. So yeah, it's oh, I was like, I got 7 right. I don't even know how that happened. I didn't answer anything, but I did. I know. The drop-down question. Yep, I did. Any questions on that one? I know I tricked you guys on that one, but it obviously, I did that on purpose because many times we forget about age to look at too. And like these guys do come in once in a while, or I shouldn't say once in a while, a lot. for shelter animals, and we forget to even bump up their MER for surgery purposes all the time, and it drives me crazy. But we definitely need to make sure that we bump them up if and when they are extra young too. So, okay, so taurine and L-carnitine can be found to aid in what? Good, heart muscle function, awesome. And then soybean meal is often a basic component of the ferret's diet. And what does that ingredient provide? Good, protein. So this one was like kind of funny because I just threw in ferret, but you can always, it doesn't even matter, like a ferret, cat, a dog, or whatever. You just need to know what a soybean is. So yeah, soybean is used a lot of times in some of the lower brand foods, just to substitute it because it's cheaper than actually using a meat source. So they bump up the protein content by using soybeans. So, but it's not as digestible as actually meat source. So yeah, it's used for protein. Okay, so I actually want to get to our extra fun point. And so we're actually pretty good on here. Oh, this one I wanted to go over. Which of the following is a water-soluble vitamin? Yeah, vitamin B. So the way I remember it is this acronym right here. So it's DEEK. So these vitamins, D, E, A, and K, are fat soluble. So vitamin B and vitamin C, they are water soluble. So you can eat as many oranges as you want, and you will not overdose on vitamin C. You will pee it out. And yeah, you will urinate out all the vitamin B if you take as much as possible. So you don't have to worry about that. But you can absolutely 100% overdose on vitamin D, vitamin E, vitamin A, and vitamin K. So you have to be really careful. So yeah, that's how you can remember those guys. Great. So I have, let me see if I can find it. Maybe not. Here it is. So I have a really fun game for you guys. I probably have to reshare this so that you guys get the full effect. Hopefully you like games. So you may need, I don't remember if you're going to need a calculator. You may need it. You can use your phone as well. And you're competitive. Awesome. Oh no. All right. So, or you can use your computer too. So go to this website, menti.com, and there's a code that you'll enter here so that you'll be able to access this page and do our game. Look, I already got someone in here. Look, they're already going. All right, are we all getting there? Menti.com. menti.com. Good. I think we're getting there. All right, let's see. Great. All right, so we definitely are getting there. So yeah, looks like most people are the most confident in animal nursing. Looks like you guys are a little bit confident in nutrition. We have some confident in anesthesia and surgery, still working on some dentistry. Pharmacology is our least confident, which is, it's surprising we have confident in anesthesia, so that must be more monitoring aspect versus the pharmacology aspect. So we'll have to do some work on that. And then radiology is always the interesting part. So yeah, we'll do some work on that. Awesome. Great. No, it's good information for me. All right, so rate the areas of practice that are going to be most important that you guys think in the future of veterinary medicine. So there's no right answer here. Just what do you guys think? This isn't like the extremely fun part yet. Don't worry. I just like to get your input. Pick. All right. Ooh. Awesome. So pain management we had, which is great. It's always growing, so that's awesome. Nutrition, that's a good one. Dentistry, of course, it's growing. And then flea and tick prevention. I mean, we've done so much with flea and tick prevention over the years that, yeah, I don't know what else we can do. Gosh, with maybe just, I don't even know. So yeah. But we have some work to do in these categories up here. So that makes sense. Yeah, I like it. All right. So how confident are you in educating clients on nutrition? How do you guys feel at this point with educating clients on nutrition? Honest answers. Great. So confident. You can inform pet owners of basic stuff. Good. Feel confident when educating them, just making sure that it's relatable. Confident in the this last couple weeks. Good. Kind of okay. Somewhat confident. Good. I'm unsure if I would be good at educating clients. I tend to be blunt. That's not a bad thing, which is something I need to work on in this field, but I am sure I can educate. I am extremely blunt as well, which doesn't necessarily mean it's a bad thing. You just have to make sure that it's an honesty thing, right? You're being honest, but you just have to make sure that it's not rude or anything like that. It's a professional honesty, I would say. So that's a good thing. So you want them to feel like you're taking care of them and you're looking out for them. So that's good. All right, so what type of food does your clinic carry if you are at a clinic? And you can pick, I know that many clinics have multiple, so I believe you can pick many. Oh, interesting. Gosh, the last time we did this, like so many had hills. So very interesting. And look, Purina is like catching up. Look at all these Royal Canin too. Wow, very, very close. Who has the other? What is the other? What do you guys carry? Not at a clinic, but I will pick what the clinic had where I did my externship at. Awesome. Very cool. Okay, so did you feel the training at in the animal behavior you had makes you feel ready to help educate owners in practice? Good. Yeah. You've probably seen a bunch of crazy behaviors, right? Not only just dogs. We think of dogs a lot, but cats do crazy things. Ooh. Yeah. That's no good. Yes. Yeah. So yeah, educating clients as well to show them different videos would be fabulous. Clients can definitely, it takes a lot of coaching with owners because it's a lot of work at home for them too. So Yeah. And not only that, but they need a lot of praise. So it's funny because animals need praise, right, for them doing good. And then we need to praise owners for them doing good too. So it's a lot of work. But you're right. It can be a stubborn aspect of things, but they also need to know that they're doing a good job too. So it's a long process with behavior stuff. Okay. So everybody may not have seen this video from earlier this week, but I wanted to show you guys this video. Oh yeah, it's okay. So I wanted to show you guys this video of what anxiety may look like. Oh, I don't want to actually share my sound. Don't share sound here. Okay. So take a look at what anxiety you guys think looks like and take note of like certain aspects of what he does. And then be prepared to write down what he's doing in our next section. All right. So just watch it. It's a couple-minute video. I'm not sharing sound on purpose because in the video, I'm saying exactly all the stuff that he's doing. So I'm giving you all the answers, but he is like whining in the video. All right. And now it wants to play again. All right. Great. So what does anxiety look like to you guys in this one? What did you notice that he was doing? Panting, pacing, dilated pupils, yeah. Attention seeking, yawning, restless, whining, yeah. 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 Great. Yes, C-shape and eye, very good. Freezing, yes. Yeah, he's whining, definitely. Pacing as well, Didn't want to leave the owner, yes. Yawning, ears back, yeah. Tail down is another one, right? Anyone mention, let's see if someone else Yeah, the shaking, good. The shaking is a good one, right? We like it when they shake because they're trying to shake it off, right? It's a reset button. But it is a sign of anxiety, right? So lip licking. Yay, I'm glad I waited for that one. Good. Lip licking, a lot of that. He did that a lot. Very good. Look at you guys. You got it. Yeah, he did a ton of stuff in there. It was like every single thing that you could ever think about. It's like a total anxiety video altogether. So paw raises, yeah, yawning, just everything. So yeah, he's my dog. He was my dog, I should say. And he just his whole entire life literally was anxiety filled, and that was him on Prozac and trazodone that he was on all the time. So yeah, it was crazy. All right, so now we have our game. So I am going to turn this down because it is crazy loud. All right, we have everyone here. Great. So this game is you have to try to answer fast and you get more points the faster you answer, but you also have to get it right. All right, so let's see how well you guys do. Oh, you got it. I started with an easy one. Don't worry. It is the socialization period. Right? Oh my gosh, you guys are too good. Oh, some of you are fast. Look at that. Oh, good. Good. Yes, wet tail. Just talked about it. Yeah, vitamin D, right? Because we'll just be that, guys. Good job. All right. Question 5. See how well you are up there. Lab stuff. Ooh, we're preventing, right? We're preventing our struvites. So struvites are more alkaline, so we want to prevent it by going into more acidic diet. Good job. All right, let's see our leaderboard. Oh, we got 2 Sarahs in the lead. Great. Question 6. Oh, look, we just had this question. Look, you guys are so fast. I wonder why. Good, you guys all got it right. I don't have to be mad at you. Awesome. alcohol, right? Because that makes us that makes chloroform bleach and alcohol. So we don't want to do chloroform. And then 1 to 2 is like super concentrated. So it's 1 to 32. Some of you are so fast. Good job. It's a hairball. Yeah. All right, question 9. Sometimes you do want to grasp them around the thorax, but we can't. Awesome. Yeah, birds. We can't squeeze them, guys. All right, let's see our leaderboard now. Ooh. We might have a little bit of a game changer here. Oh, yeah. Good job. All right, we're on question 10 already. What's their initial response? Good job. Their initial response is to run away, right? They're a prey animal. Their initial response is always to run. Good job. All right, so question 11. Very good. Yes, it's the back leg, right? The front leg that is the little tiny leg is not enough muscle there to grab. Their tail is so tiny it'll break right off for their whole body, so we can't grab that tail. And their ear, that would just that'd be a little mean, so we can't do that. So, good job, back leg. Great job. Yes, it's gerbil. Very good. Good job. Awesome. Yeah, potassium, we need it for muscle function. Very good. All right, 14. Good. Yeah, so it's azoturia. So remember that grain for these guys is going to be their protein source. So if we have too much protein is excreted through the kidneys. And so if they're just sitting there, and it's not going to it's going to cause them to be azotemic then, because their kidneys are going to have to function or overfunction, right? So that's why they're going to be azotemic in that sense. Ooh, Megan, good job on that. Our koala, look at her. Look at that. Awesome. Oh, the two Sarahs are back in the lead too. actually substantiate, I guess, the claims by just setting guidelines and definitions. They don't do anything else. So it is very, very narrow focus for them.
It's my class. I paid for it. I ain't even get that.
Very good. So in their eyes, right? So if we look at those fearful eyes, somebody mentioned it earlier, they're going to have dilated pupils, right? Not constrictive pupils. So good job in reading that one. Very good. All right. Oh, I gave you guys, let's see if you listen to me. I already gave you this a little bit ago. Ooh, 3 people listen to me. Look at that. Yes, a protein that is not used, we don't store it as energy. We actually excrete it. We store fat, and we can store carbohydrates, but we don't actually store protein. It's excreted through our kidneys. Very good. Great job. So yeah, they're actually night droppings. So yeah, they're not day droppings. Very good. All right, let's see who our overall leader was. Oh. Wow, Megan, you won. Good job. The koala won. Very good. Great. Oh, get that crazy music out. Okay, so 3 areas of being a veterinary technician would be your dream job. What would be your dream job? You'll have to type fast. All right, So we had pharmacy, laboratory, anesthesia, radiology. Oh my gosh, that's so many different ones. Zoo, nutrition, just helping patients, general practice, dentistry, emergency transport, ER, a lot of surgery here. On call, someone wants to do on call. Wow. Wow, all different stuff. That's really awesome. I love it. All right, so this one is honestly rating these statements. Interesting. So yeah, you currently study at least 1 hour every day. That's awesome. And even if it's not 1 hour every day on average, you guys are doing even just a half hour every day, 45 minutes or whatever. That's great. Good job. I totally get some days it's hard, but then the next day you get right back on it. So that's great. You felt prepared as a veterinary technician when graduating school. Wow. Yeah, that's unfortunate. These are things that, you guys may know too, that I am pretty involved in still with vet tech educators, even though I'm not teaching in school, but really trying to help those guys out too, of getting a little bit more in depth of education and making class fun and like culture and that kind of thing. And then just, different ways of teaching too. So we got to make this better, because this is a problem. I don't want you guys left behind. So this is something that I feared. So yeah, it's good to know. You felt supported while in school by all your instructors. This is good. I would love to see it at least at a 4, but it's good that it's at least at a 3.3. So I like that. Your school had a great culture. Again, I would love to see it at least at a 4. So I'm sad that it's really down here. Like, we can't have a good culture in our industry if our schools have not a great culture, right? If you guys are starting out in the field with not a great culture, you're already learning what bad culture looks like. So something that, again, we all have to work on. It takes the village, right? So but it's really good to know stuff that I really want to work on. So your externship was fulfilling and taught me what I needed. That's awesome. You guys you went to great externships. So fantastic job. I'm glad that you guys learned a lot and did some good stuff. So great. Fabulous. That is great. You guys did great with all those questions and stuff. Really, really awesome. I think you guys nailed it with animal nursing today. So fantastic job. Great. Any questions? Look, I got celebratory streamers and all. I like it. Oh, and a heart. So awesome. So you guys like the quiz aspects of things. Yay. Good. Oh, you did fear-free. Yay. See, I'm just catching up to you now. Oh, good. You do like it. Great. No, that's good. Yeah, I'm working on putting some more of those guys together too, just to make those fun, ask questions to you guys too, because I want to find out more information from you guys and how I can help you guys more too. And yeah, just do some extra fun stuff as well, and not just, do the same old stuff all the time. So I want it to be fun and engaging and have a good time. So, yeah, absolutely. And plus, you guys get bragging rights on who wins at the end. So bragging rights are good. Any questions for me this week? You guys did great, really great. Now you have to do and catch up on the additional work. And I know now too, we got to do some pharmacology work. So I'll get busy on putting some stuff together so we can catch up on some of that stuff. So, and fill some of that stuff in. And I know you guys always want math. So everybody wants math. Great. Any questions? You guys are so quiet. I have to break you. So you guys talk all the time. Awesome. Well, thank you guys so much for joining me. Thank you. I appreciate it. And happy Mother's Day to all of you who are moms out there. Really hope you guys have a great weekend. Take some time for yourselves and enjoy the nice weather if you have some nice weather out. And yeah, don't study all weekend. Enjoy some time to yourself. So yeah. And yeah, I will see you guys next week. And so if you need anything throughout the week, reach out for sure. And I will see you next week. But have a good night. Bye, guys.